Intramuscular injection. Introduce yourself to the patient.
Hi, I'm Anna. How are you today?
I'm fine, thank you.
Confirm the patient's name and date of birth.
Could you confirm your name and date of birth, please?
Lucy, 12th of July, 1997.
Explain what Medogen is.
Nice to meet you, Lucy. You are here today to have the contraceptive injection, Medogen. It's medroxyprogesterone acetate, or DMPA for short, and it's injected into the muscle. It contains a hormone which is very effective in preventing pregnancy. No one will know you're using it. It needs to be repeated every 3 months. Do you have any questions?
Yes, a couple. How does Medogen work?
Medogen is a World Health Organization approved intramuscular contraceptive injection that is over 99% effective in preventing pregnancy. The hormone works mainly by preventing an egg being released every month. It also thickens the mucus or discharge on the neck of the womb, which can stop sperm moving.
Okay, can I start the injections today?
It can be started within 7 days of the beginning of your menstrual period to ensure immediate effectiveness. It is also possible to start it at any point of the menstrual cycle, if we are absolutely certain you are not pregnant. In this case, an additional contraceptive method should be used for 7 days. When was your last normal period?
2 days ago. My cycle is regular.
Great, so the effectiveness will be immediate.
Are there any side effects?
You may see some changes in your bleeding pattern, which could become lighter, more frequent, or irregular. This is not harmful, and some women who experience heavy or painful bleeding find this is a helpful side effect. Other women could experience headaches or weight gain of 1 to 2 kilos. If you find any of the side effects troublesome, you can come back anytime to discuss other options.
Check for any contraindications.
Are you pregnant or are you breastfeeding?
No.
Are you allergic to anything? And do you have any bleeding disorders or do you take any blood-thinning medication?
No.
Medogen is safe for most sexually active women, including those with HIV or who are on antiretroviral therapy. But it's important to know it does not protect against STIs, so condom use is important.
Good to know.
The final point that you should know about the injection is that you may not get pregnant immediately after stopping the method, meaning that it could take up to a few months to conceive again. Is this an issue for you?
Obtain consent to proceed with the intramuscular injection.
Do you have any additional questions? Do you consent to the injection? And are you aware that you need to come back every 3 months for repeat?
That's all fine. I don't have any other questions.
Okay, I'll just go gather my equipment and we'll start. You may briefly experience a sharp scratch as the needle is inserted, but it will be over quickly.
Gather the appropriate equipment. Non-sterile gloves, apron, equipment tray syringe, the smallest syringe that will accommodate the medication volume. Injecting needle, 21 to 23 gauge. A standard length is 25 millimeters. Drawing up needle, also known as a blunt filter needle, filters out subvisible particles of glass, rubber, and other residues when drawing up medications from ampules. Alcohol wipe, 70% isopropyl, gauze or cotton swab, sharps container, the medication to be administered, the patient's prescription when required, wash hands, put on gloves, check medication to be administered. Shake vigorously the sterile aqueous suspension of Medogen. Draw up the medication using a drawing up needle. Dispose of the drawing up needle immediately. Attach the injection needle to the syringe, 21 to 23 grams. Position patient so that she is sitting comfortably.
It's time for the injection now. Just relax the arm and breathe.
Palpate the lower edge of the acromial process and inject approximately 2.5 centimeters below this. Clean injection site and allow to dry. Apply gentle traction below the injection site. Insert needle deep into muscle at 75 to 90 degrees, bevel facing up. Inject content of syringe slowly, 1 milliliter over 10 seconds. Remove the needle. Release traction and apply gentle pressure to the site. Dispose of the sharp. Apply plaster. Remove gloves and dispose of all clinical waste appropriately. Thank patient.
Lucy, we completed the procedure. Thank you. For the next few days, your arm may be slightly painful, and that's normal. Keep an eye out for any signs of infection, which are redness, discharge, or swelling. If you're worried about bleeding or pain, come back to see us or seek medical advice.